Let's discuss about the A delta fibers and the C fibers. Before we go to the fibers, let's talk about the histology of the pulp. So in pulp we have different layers, and the outermost is the dentine. After the dentine we have predentine, which lies in the inner portion of the dentine, which is not mineralized, and it lies next to the pulp. Then we have an odontoblastic layer which lies down the dentine and it lies next to the pulp. And next to the odontoblastic layer we have a cell-free zone of veil, where there are no nuclei or cells present in this region, but you have nerve bundles, and we will be discussing about this one. After this we have a cell-rich zone and then the pulp core. Now coming to the dentinal pain, it is conducted by the A delta fibers. Now, A delta fibers are large, myelinated and afferent nerves. So they carry the stimulus from outside to the inside of the body, like from outside to the center, from periphery to the center of the body. The dentinal pain that is conducted by the A delta fibers is usually sharp, transient, and the first pain. So in a situation where you stab your finger, it's the first initial pain that is sharp, and that is, like, you can remember that the first pain is by the A delta fibers. So these fibers actually lie coronally when compared to the C fibers, which lie centrally. That is the reason why the first pain is usually felt by the A delta fibers, and they are associated with cold temperatures. Now coming to the second pain, that is the pulpitis pain, is more associated with the C fibers. Now C fibers are small, unmyelinated and afferent nerves. So they are seen centrally. They are located centrally when compared to A delta fibers. They are in the pulp stroma, and usually they are associated with dull throbbing pain. And more associated with heat. So like for A delta we had sharp pain, the first pain, transient pain, and associated with cold. With C fibers we have dull throbbing pain, which is associated with heat. So in a situation where you stab your finger, it hurts first a lot initially, so that is the A delta fiber. You could remember it as the first pain, and after a while the pain gets sore, dull and achy, so that is something more with C fibers. So always remember that A delta fibers are super painful. Like anything that is super painful is because of A delta, and the second pain, that is the long dull pain with less intensity, is because of the C fibers. And the A delta fibers are located at the pulpodentinal complex, that is where the pulp and the dentine meet. That is why they are provoked easily when compared to C fibers, which are located in the stroma, that is in the center of the pulp. And also keep in mind that inflammation can over a period of time become dull and throbbing. So the pain that was once because of the A delta fibers now can be because of the C fibers, because of the inflammation and the change in the nature of the pain. So that is all about the A delta and the C fibers.